Oh
Good.
my goodness. Wow. That feels
Okay.
good. I couldn't work. My nerves were inflamed to the point it was burning. I can't sleep. I can't lift anything. I just wish I had found you sooner because then I didn't have to go through all that. Well, I've been having this pain for quite some time now. It's all primarily on my left side. 2005 was when the car accident happened. Almost 18 years. We were stationary, but I was this way. I was driving and the impact happened from behind. It was quite big in a sense. And I think the whiplash just had me go in this motion is what the doctor said. So I've been kind of having that pain adjustment from Kaiser, but they never really truly treated it. It's just more stretching my neck and that was it. Kind of sent you your way. Typical, right? So yeah, I'm kind of done with it because it does wake me up and give me headaches from time to time. And I feel like it is also a source of my elbow issues.
Let's start with the last thing you said. Okay, so
Sure.
you said it goes to your carpal tunnel. So tell me
So I
where
feel
you
it
think
right here.
Okay.
I know they did a nerve test on me, but
And
they never told me
with
whether it's
needles?
related.
NCV?
Yeah, it was painful quite, yeah. But the doctor never explained to me whether that's the same nerve, because my question always is that the same nerve that's pinched right here that you told me years ago? But they don't.
That's what
They
I'm trying to
don't
figure
tell
out.
me.
Yeah.
Yeah, right here. Just, I feel like the burning sensation. Yeah, and
Okay.
weakness.
So that's not your carpal tunnel.
Oh, it isn't?
No.
Okay.
Yeah.
Okay.
That's nowhere even near your carpal
Okay.
tunnel. So just so you know.
Okay.
So your carpal tunnel is actually over here. So that's where
Oh,
your carpal tunnel is.
so they've been lying to me. Sorry, go
Yeah.
ahead.
A lot of people get misdiagnosed. So I mean,
Okay.
so let's take a step back.
Sure.
One of the first things that we do
Mhm.
is, I mean, you can look at that chart.
I
We
was
call it a
reading it.
funnel diagnosis.
Yeah,
So we want to get all the information so we can narrow down, right?
perfect.
Because if I can really narrow down,
Mhm.
then I know what tool to apply, and then I can kind of do almost the one. I'm hoping actually, like it's all related to the same thing, which is what you're
I'm
hoping
hoping
to,
to, yeah.
because then it's kind of a one shot, one kill instead of a spray and pray approach, right?
Yeah.
I don't want a spray and pray approach.
I appreciate
And,
that.
yeah, I want to know if it's all stemming from the same issue, which it actually sounds like. So it's actually a good thing that it's not carpal tunnel, because if
Okay,
it
that's
was,
good news.
it would be separate problems that are actually compounding on each other.
Okay.
So it sounds like it, but I have a few more. That's why I'm going to ask you a
Sure.
lot of questions, because we need the information to be able to do it.
No, and I appreciate that because I'm tired of it.
Where do you feel the headaches?
I would say they start to emanate just on the back of my head right here mostly.
Okay.
And whatnot. But sometimes I don't really understand how headaches work, but typically it's around that hemisphere for me.
When your shoulder hurts,
Mhm.
you say like,
Yeah.
you keep pointing to kind of more the front, right?
Yeah, I feel like a lot of it is right there.
Got it. Anything else going on that I should be aware of?
That I mean, I talked to them about my tailbone.
What's going on with your tailbone?
If I'm in prolonged sitting, it is difficult for me to get up. Like it's too painful. I have to catch myself.
When you say tailbone, can you show me? Because a lot of
sure.
people.
I think it's my tailbone, but maybe it's
Yeah,
not.
yeah, no, it's okay.
Like I feel it right towards right there.
Okay.
Yeah, and then it makes me.
That's not your tailbone.
It's not my tailbone. What is that?
Yeah.
Anyway.
Hey, I mean,
but
high five.
But it is painful. That's good. That's good. That's good.
Yeah. Just gonna feel a few things in here. You feel pain there?
No, just uncomfortable.
Right. Tender?
Yeah. Oh yeah, right there. That's not fun.
Is it worse over here?
Yeah.
It gets worse as I go further
down. Yeah.
Okay, so your sacroiliac joint is this like joint where it's a couple inches long. What's happened is basically it's sprained outwards like this.
Oh. Okay.
And then it's also sprained upwards like this.
Okay.
So what happens when it sprains upwards is it basically feels worse at the bottom of the joint, because if there's a movable, which it usually is, it would sprain the bottom part of that joint, right? And so you feel it like kind of low down, because it's already sprained like this, and your body needs to go the other way to be able to sit. It like tries to close, but it can't close. So these are actually really good things. I'm just going to tell you, because one, a tailbone problem can usually suck a little bit more, especially when there's like my wife actually has a fracture.
Okay.
So it took her a lot longer to kind of heal from that when it sprains, because it's just like a very, very sensitive joint. The sacroiliac joint is a joint that's really built for stability.
Okay.
So when I can reposition it, it usually heals a little bit faster than a tailbone does.
Oh,
So,
good news.
yeah.
That's great.
And the
Okay.
good news is it's very much connected with all the things that you're feeling over here.
So it'll
too.
help all at once.
Yeah.
Awesome.
Yeah. Yeah.
Okay.
So
Good.
these are all good things because, I mean, you've already been through the mill over the past couple decades. It's usually like, oh, treat the ankle, treat the knee, treat the, and just everything's a separate problem.
Yeah.
And it's not. They're all related to each other. Cool.
And thank you for explaining it to me.
Yeah.
That's helpful for me to understand.
Yeah. So let's have you sit back here.
Okay.
So first things I'm going to do is I'm going to work on your T2, and I'm going to work over here. Okay. That just as a side note is because a lot of people think that they're like the value is in like just the adjustment.
Yeah, which is what I was taught in a sense over the years. So yeah.
Yeah, it's just like, oh, I'm just paying for the adjustment. Well, the
That
value
doesn't
that
heal
was
it,
actually me finding exactly what to do in
Yeah.
this iterative process. Yeah.
It's more than what Kaiser has ever been able to explain to me. So I appreciate you telling me how it all connects.
Yeah. Because otherwise, I would just then all my value, if I didn't do that iterative process, would just be the popping or whatever.
Right.
Yeah.
I agree.
Is while you're strapped in there, I just want you to see. It's this nerve specifically that's actually compressed into there. So what I have to do is I have to basically lift this off so that it takes the pressure off of that nerve. But I have to adjust it relatively like more forward. So you see how I can take pressure off of it. So I can do that. So that doesn't really help. It has to
lifting it up.
Lifting it off of that nerve. Yeah.
Okay. I'm okay.
Is that okay? Okay. So that's me taking the pressure off that joint a little bit. At least to prep it. And then what I have to do is give that a push here. Okay? So.
Oh my goodness. Wow.
Yes.
Okay.
Not too bad, right?
Not too bad. Wow. That feels good. Thank you.
Yeah. You are welcome.
Wow. Thank you.
Yeah.
My head feels a little lighter for some reason.
Feels a little lighter.
Yeah. Wow.
Okay.
Okay. Feels good.
Feels good.
Yes, it does.
Yeah. Good. That's a hard adjustment because it's your upper back that I'm adjusting. We are going to do the one for your headaches, okay? It moves a little differently in that it goes side to side. So I'm just going to adjust it from the side with my thumb tip. It's a little push. Good.
Yeah.
Okay, good. Here.
I can feel it much better though. I feel relieved.
Relieved.
Yeah.
Good. So again, you've had it for so long that a lot of that is going to be residual swelling that's in there. You have like a hump over here.
Yeah,
right?
I do.
Yeah.
I hope you can help me.
Yeah. So a lot of times we can alleviate a lot of that, but that's the kind of what I'm talking about is tissue starts building up around it.
Yeah.
And it can actually build up around that joint too.
Oh, okay, so adding more pressure on it.
Adds more pressure onto it, right? The chronic inflammation just makes the tissue more like hard into there.
Whatever you did here, the burning I had earlier.
Yeah.
So it feels a lot better. So thank you.
Yeah.
Feels good.
So right tool, right?
Yes.
And then I can just one shot, one kill.
Yeah, that was amazing. Okay.
Okay.
Awesome.
This one is a little bit hard, but
when
I say a little bit, I mean a lot of it, but it's okay. I'll show you what I'm going to do.
I'm making him work today.
Yeah, exactly.
Sorry.
Let's push it down like that. Okay. Just relax.
Oh,
good.
my
One
God.
more. Good.
Yeah.
Okay.
Okay.
You all right? Okay.
Okay, I think so.
Okay, come on up. Let's have you walk around a little bit for me.
Feels looser.
I'm going to have you do another squat for me.
Okay, squat.
Yeah.
Oh, okay.
What's up?
Not bad.
Not bad.
Not bad. Not like earlier.
Yeah. It should start feeling better quite a bit.
It feels better right now. I feel like it's breathing.
It's breathing.
Is that good? It's breathing than it was before. How's that? So,
yeah.
I mean, it was really pivotal for me to understand that they're all connected. Because coming to Kaiser was like everything's treated separately.
Yeah.
And so even though I tell the doctor I think it's connected, I don't know if they don't want to believe you. They just tell you to Motrin up or something. But yeah, it was really nice to hear, and the confirmation, I think, is what it was, is that it's the stuff I've been thinking it was.
Yeah.
But it's just the system. The way their system works just prevents the people like me to really truly understand what is the root cause, right? So
Yeah.
I just wish I had found you sooner, because then I didn't have to go through all that, if that makes sense at all, right? Because I couldn't work for about a month. I had to stay off my arm. Nice to see you guys and being here. I'm actually pretty impressed. Thank you.
Awesome.
Nice to meet you.
Yeah.
Thank you very much.
Yeah, absolutely. We'll see you next.